All right, fully connected layers. So fully connected layers, the next lesson, and these are important parts of a convolutional neural network or a recurrent neural network. And these are the decision-making committee of AI. Now, imagine a hospital case, a case conference where there are different specialists from different departments. Let's say, for example, cardiology, radiology, pathology, nursing. All of them sit together and share their observations about the patient. And each specialist contributes their expertise, and together they reach a conclusion about the diagnosis and treatment. And this can also get very complex. And these are the type of models that you will need to understand and help explain to the patient that, hey, the AI is giving us an answer or giving us a recommendation based on this model. But when the patient asks, hey, they didn't include my surgical history, you should know about that, because you being the AI, the human in the loop, not the AI in the loop, you being the human in the loop, you need to know what the model is all about. Now, by simple definition, fully connected layers are like a meeting where every piece of information the AI has learned gets to talk to every other piece of information to make a final decision. Now, we have this committee over here. You can see different members of the committee right over here. And real world analogy, let's see, it is like a decision-making committee. So we already talked about this. And why this actually matters in medicine? Because no test or symptom tells the whole story. A fully connected layer allows AI to think more like experienced doctors who consider multiple factors together. And as we know, and anybody who works in any clinical setting, one variable, one aspect is not dangerous or might be dangerous just in itself. And you have to look at the whole picture. For example, just an elevated heart rate could be a significant feature for a particular patient. However, for a different patient, that may not matter at all, right? So you have to look at the whole human holistically. Now, let's do an example patient. Let's follow a patient named Sarah. Okay, if this is Sarah, maybe I need to get some longer hair over here, possibly, right? I think I messed up with this diagram. Anyways, maybe I should have had Steve over here. Anyways, so, and this AI system is designed to predict hospital complications, perhaps. All right, the first stage will be step one, of course, in information gathering. Now, different parts of an AI system process different types of patient data. We have vital signs, heart rate, blood pressure, temperature. We have lab results. Could be anything, you name it. Medical history, previous conditions, medications, family history. You got surgical history. You got the physical exam in there. Then you can have imaging, x-rays, scans, anything. Now, the key point to remember, my friend, the key point to remember over here is that before the fully connected layer can make decisions, specialized AI components must first process different types of medical data. They have to internally process their data, and that leads us to our next slide. Now, the next step is where the committee actually sits down together and discusses a few aspects. Now, the second step is the committee meeting. So this is where all information comes together. It's like having all the specialists sit around a table. Now, the AI agent or the specialist that is looking at, let's say, for example, you are a specialist, but this is technically an AI agent. They're looking at hey, her heart rate has been gradually increasing. That is a point to consider, my friends. The heart rate is gradually increasing, my fair judge. Then you have the lab specialist. Her white blood cell WBC count is elevated or maybe elevating. Then you have the history specialist. Well, she had a surgery 3 days ago. Okay. You have surgery 3 days ago, right? And the vitals were okay, but the heart rate is now increasing, and the white blood cell count is now increasing 3 days after the surgery. These are all ominous signs. And the imaging specialist is saying, hey, well, there's fluid accumulation in her lungs. All right, additional piece of information. So I want you to keep this in mind, the key insight. Just as medical teams are stronger than individual specialists working alone, fully connected layers create powerful insights by allowing every piece of information to influence the final decision. Now, we don't want, a lot of times we have seen, even with ChatGPT and all of these different LLMs, that they tend to try to agree with you. But you cannot have that in medicine. You need people to disagree with you when it's needed. So in this manner, in this structure, we are creating a system where, everybody will be arguing their point. You need all those points to be taken into consideration. Dear all, I hope you are doing great and that you are liking these lessons and you are enjoying and you are learning. And I did want to suggest something as an option for you. Only if you are one of those who want to have this content in a more organized manner, there is a program that I have set up that you can find in the description. It absolutely is not necessary. However, it is only for those who do thrive in an organized approach, and there just might be a few more goodies there as well. Anyways, I wanted to share this, and now back to the video. And then we come to our step 3, and that is the decision. Now, the fully connected layer weighs all of this information together and might conclude, based on the combination of increasing heart rate, white blood cells, recent surgery, and there's fluid in the lung, maybe some infiltrates perhaps, that there's a 75% chance or probability that Sarah is possibly developing a post-surgical infection, and that might present itself more prominently within the next 24 hours. So now your AI has to be able to give you this explanation. It's just not saying, hey, I analyzed and I think this is this. It should give you a one-liner, a one-line spiel of what it thinks is happening. So the fully connected layer weighs all information together to reach a conclusion about the patient. And what we talked about, based on the combination of increasing heart rate, elevated blood cells, recent surgery, fluid, there's a 75% chance that I may be developing post-surgical infection in the next 24 hours. So why this matters? This integration allows AI to consider how different factors interact with each other, not just individual symptoms in isolation, as we discussed. And clinical value, it could be early warning, allows preventative measures before complications develop, potentially saving lives and reducing hospital stays or reducing length of stay. Anyways, we know as clinicians that how these things can be developed and how these things can be highly important. And I remember a case, actually when I was in residency, and we were doing some outpatient medicine and our family medicine clinic. And there was a patient I saw on her lab work that, hey, she might be developing multiple myeloma. And it's, to be honest, very easily picked up. However, people could have picked up those lab values to be multiple myeloma, or at least developing multiple myeloma a few months earlier. But they did not actually look at the pattern that was happening on the lab work. And as doctors do, they detect patterns. Similarly, AI will be doing the same thing, and AI might be picking up patterns before the doctor picks it up. Hey, doc, it will give you possibly a reason alert that I think that this needs a thought. Would these values be suggesting this result, or this outcome, or this complication developing, or this medical issue that we need to take a look at? So this is how AI will be helping and integrating into our clinical workflows. Now let's actually discuss another example, and we talk about the heart because, very common and easy example that everybody can understand. So heart attack prediction. And, in the hospital, we have to wait for all the results to come in, and then we may be dealing with 5 other patients, and we get the chance to look at our first patient after like 2-3 hours. So an AI system will be working in the background and will probably alert the doctor, hey, so all of these factors have come back, and all of these factors are pointing to a certain condition. Can you assess this or look at my conclusion, and maybe you want to take some type of action? So an AI system predicting a heart attack integrates multiple data points that would normally be analyzed by different specialists. All right. Well, not necessarily, but all of these things a single doctor can potentially pick up. But anyways, these are different departments that we can all look at. Chest pain, sharp radiating to the left arm, vital signs, blood pressure, let's say, is elevated, heart rate is also high. Lab results, elevated troponins, medical history, previous heart attack 5 years ago. EKG findings, ST elevation in leads 2, 3, and AVF. That's an inferior wall MI happening right over there, my friends. And I have this diagram over here, EKG, everything is being brought together, lab results, and you get an answer. You have a 95% high confidence, and you need to also know, and we'll talk about this later, what are confidence intervals. Confidence, and you may have learned some of this in statistics, but my friends, if you do not learn or understand confidence intervals and precision and sensitivity, specificity, accuracy, all of these terminologies, negative predictive value, back in medical school, perhaps you forgot all about it. Well, in AI, you need to know these things. We will talk about this in this program, and that is how you will be assessing whether a system, a vendor, or system, or what is the performance of AI in your own medical setting. So we'll talk all about this, but this is just a prelude to get you the basics to have a broad idea how AI will be for you and what you will be looking forward to learning in the future. Now, when an AI system gives a doctor, a clinician, a recommendation, this is where the action happens. The fully connected layers are where that recommendation was actually formed. And this is important because, let's say, for example, patients can ask the doctor, hey, what information did the AI use to make this recommendation? So in the future, patients will be asking, how good is this AI? Is this including is it including the information that I went to a Chinese restaurant 2 days back, perhaps, right? Is it also somehow including the information that it was a very heavy, rainy, and smoggy, damp, hot day for the last couple of days? Because we know as clinicians, all of these actually play a huge part in what is happening to a patient. So this is where the money is, and I think you are understanding. So understanding that this is all based on multiple factors working together and not just one test result. So knowing that the AI considered all available information, like a really thorough medical team would, this can increase the confidence in its recommendations and help out with your patient environment. If, for example, you disagree with an AI recommendation, you can discuss whether all relevant information was included and properly weighted. And if you find an AI system that is deficient, maybe you need to get another vendor to provide you with a better AI system who looks at a lot more factors than what your current AI system is looking at. So this, my friends, in a way, is a rather simplistic lesson, however, very important. Hopefully you enjoyed this, and on to the next lesson.